in a house where you have to climb over piles of garbage just to walk from one room to the next. Also imagine thinking nothing is abnormal with your behavior in the way that you're living. According to the American Psychiatric Association, people with hoarding disorder excessively save items that others may view as worthless and persistently have difficulties getting rid of those items, which leads to clutter that disrupts their ability to use their living and work spaces. Hoarders are people who accumulate things and have a very hard time getting rid of those things. It is a serious disorder that is seen in many different types of people. There are many different ways to dive into the topic of hoarding, such as what we're going to talk about today, which are the causes of the disorder, the signs and symptoms of a hoarder, and what a hoarder is exactly thinking while they're hoarding. Um, Hoarders can start their behavior at any age. According to the International OCD Foundation, the typical age of onset behavior is around 13, and in their 20s and 30s it progresses into a mild problem, and in their 40s and 50s it becomes more serious. Although it is seen throughout the lifespan, it is more prevalent in the older ages because it gets more serious. So older people experience more serious levels of the behavior. Um, the best possible way to treat the hoarding is to stop it when it first starts, so it doesn't get too far and not too serious. Um, Also, traumatic events can lead to hoarding behavior. Hoarding is also paired with other disorders such as bipolar, anxiety, and depression. So when people are having problems in other parts of their lives, they don't care about other parts of their lives, which leads to hoarding activity. Um, when a person is having difficulties, yeah, it leads to hoarding activity. The American Psychiatric Association again says hoarding is more common among people that have family members that hoard. So if a child has a parent or guardian that hoards, they are more likely to have hoarding tendencies growing up. Um, Again, hoarders can begin activity at any age and can be caused by traumatic activities. Now we're going to talk about what to look for in a hoarder. Um, According to the Mayo Clinic, they there's many signs and symptoms. Cluttered living spaces, inability to discard items, excessive attachment to possessions, discomfort letting others touch or borrow possessions. They're not sociable. They don't leave their houses very much. They're embarrassed sometimes, and they like to push people away because they don't like how they live. Um, so they may accumulate junk and everything in their homes, but honestly, some don't even realize that they're doing something wrong. Many people, when they're hoarding, don't realize the seriousness of their hoarding. The Institution of OCD Foundation says there's 4 things that normal hoarders think about when they're hoarding. The first thing is they don't want to waste anything. This is usually seen with like food. So they don't want to waste food, so they keep it. So rotting food is accumulated in homes. The second is losing important information. They don't want to lose important information, so they're hoarding newspapers and magazines. They also think about the emotional meaning of objects, so they don't want to get rid of things that's personally close to them because they feel like they're going to lose someone or lose part of themselves. They also think about the characteristics of objects. So if a person is artistic, they look at an object and say, oh, I can use that in some way and sometimes, so they save that object. Also, they feel a high sometimes when they are hoarding and they see an object and they want it. The Institution of OCD Foundation says, at the time of acquisition, people who hoard often experience a sort of high or a very good feeling where their thoughts are centered on how wonderful and how much they want that object. So it blocks out the other sensations in their mind, so which would make them to not hoard or not keep that object or not throw that out. So hoarding makes them feel good. So if you tell them that they have a problem, it's not likely that they will agree with you, and it's not likely that they will stop that behavior. Hoarders are people who accumulate things of their choice, and they don't want to get rid of them. They have a hard time getting rid of those things. It can start at any age and can be caused by traumatic events. There are many signs and symptoms that can give a hoarder's behavior away. And honestly, hoarders don't even realize sometimes that they're doing something abnormal. So now that you've seen pictures of hoarders' homes and you know what they're kind of about, you can all go home and feel a little bit better about yourselves and your houses.